A virus does not need a crowded city to become a global concern. Sometimes it begins in a quiet cabin, a storage room, or a ship far from shore. Hantaviruses are a family of viruses carried mainly by wild rodents. People are usually infected when they breathe in tiny particles from rodent urine, droppings, or saliva. The risk is highest when dust is stirred up in enclosed spaces, like sheds, barns, cabins, campsites, or poorly ventilated storage areas. This is why public health advice is so specific. Do not dry sweep or vacuum areas with signs of rodents. Wet the area with disinfectant first. Ventilate if possible. Wear gloves and remove contaminated material carefully. Most hantaviruses do not spread from person to person. The usual pathway is rodent to environment to human. But one strain is different. Andes hantavirus, found in parts of South America, has been documented to spread between people in limited situations, usually after close and prolonged contact. That makes it especially important for travelers, health authorities, and transport operators to understand. The concern became global during the MV Hantavirus cruise ship outbreak. The World Health Organization reported a cluster of Andes hantavirus cases linked to the vessel, including 13 cases and 3 deaths as of late May 2026. Passengers and crew came from many countries, turning one outbreak into a multi-country public health investigation. The lesson is not that cruise travel is unsafe. The lesson is that infectious diseases can move with people across borders, especially when symptoms appear after travel has already begun. Hantavirus illness can start like many other infections. Fever, fatigue, chills, headache, dizziness, muscle aches, nausea, vomiting, diarrhea, or abdominal pain. That early phase can be easy to miss. Then, in some cases, the illness can progress to hantavirus pulmonary syndrome. This is the dangerous stage, when the coughing and shortness of breath develop as the lungs fill with fluid. Blood pressure can drop, breathing can fail, and urgent hospital care may be needed. There is no widely used, specific antiviral cure for hantavirus pulmonary syndrome. Treatment is mainly supportive. Early recognition, intensive monitoring, oxygen, and mechanical ventilation when necessary. So, prevention matters. Control rodent around homes and travel lodgings. Seal holes. Store foods securely. Avoid sleeping near rodent activity. Clean contaminated areas safely. And, after travel in areas where Andes virus occurs, take fever or breathing symptoms seriously, especially after rodent exposure or close contact with a confirmed case. Hantavirus is rare, but it is serious. Calm awareness, fast reporting, and practical prevention are the strongest tools we have.